Yesterday to 8 p.m. we had 157,000 tests in New South Wales, which is a healthy number, and we encourage people to come forward and get tested. However, our community transmission numbers are disturbingly high. We had 478 cases of community transmission to 8 p.m. last night, and we can't stress enough how hard all of us have to work to reduce these numbers, to reduce the growth of the spread, and to make sure we're all staying home unless we absolutely have to do otherwise. Can I also extend our heartfelt condolences and sympathies to 7 families who've lost a loved one to 8 p.m. last night, 7 deaths in New South Wales. Dr. Chant will provide those details. Unfortunately, only 2 of them had 1 dose of a vaccine, and all the others were unvaccinated. And tragically, since that time, we also had that 8th death of the very young teenager, and Dr. Chant will go through those details as well. We know the vaccines are working, and it's important for all of us to protect our loved ones and ourselves by getting vaccinated. But please know that when you do get vaccinated, it takes 2 to 3 weeks for that first dose to take effect. So don't assume you're protected as soon as you get the jab. Please assume you have the virus, or anybody you come into contact with has the virus, and make sure that you continue to follow the rules as strictly as you can. In terms of Sydney, of course, southwestern Sydney and western Sydney remain those areas of most concern. And the suburbs I'm about to read out are the ones that are continuing to have escalating cases. Merrylands, Guildford, Granville, Blacktown, Mount Druitt, Yagoona, Greenacre and Bankstown. So these are the suburbs where the growth is continuing. And we really need people in those communities just to stay home. Don't leave your house. Don't cut corners unless you absolutely have to. We just want people to stay still. Of course, also in Western New South Wales, we are very concerned about communities in West Dubbo and the Walgett area and those remote communities in far western New South Wales. And we again ask everybody to stay home and not to move around. And I especially wanted to acknowledge and thank all the staff working with our Aboriginal communities on the ground to protect those communities. And I say thank you to the staff who have been receiving some support from the federal and state governments, and we appreciate all the work they're doing on the ground. Can I also stress this week, with great delight, we heard about the extra 500,000 Pfizer doses New South Wales is receiving. In addition to that, we start our program today of vaccinating 100,000 authorised workers in those key local government areas of concern. But we're also asking everybody who's between the ages of 16 and 39 in those local government areas of concern to be on alert through your employer or through New South Wales. You'll be receiving an invitation to come and get the jab this week. We ask you to book in and come and get the jab to make sure that you're protected and make sure you don't get the virus or spread the virus when you're working and then unintentionally take it home to your household. We also have with us today Nurse Sarah Fletcher, who is responsible for providing some of the pop-up clinics, and she's going to talk to us today about what's involved for those of you who want to come in and get the jab. Can I also acknowledge today Commissioner Fuller and the New South Wales Police Force start their operation Stay at Home. Commissioner Fuller has been working at it with his team to make sure the operation goes off not just successfully but with a presence like we've never seen before. Compliance is an issue. It only takes a handful of people to do the wrong thing to cause a setback for all of us. So I thank Commissioner Fuller for his activity in that regard, and we'll hear from him as well.